Dr. Andy Barnett coming to you from Portland, Oregon, and Legacy GoHealth Urgent Care. I'm going to talk to you for a couple minutes today about back pain and back injuries. The first thing I want to talk about is that back injuries are really common. We see tons of them in urgent care, we see a lot of them in the emergency department, and back injuries can usually be prevented. The two most important things that you can do to prevent back injuries are to improve your own personal core strength. So that means working on abdominal muscles and core muscles. You can look up lots of good exercises on the internet. Things like planks and sit-ups are really helpful. If you don't feel like you can follow the instructions on the internet, talking with a personal trainer or a fitness expert about what you can do to improve your core strength is really important to preventing back injuries. The second thing most people realize is that back injuries most commonly occur when lifting, so picking up objects off of the ground or off of a shelf. What's surprising to most people is that back injuries are most often caused by picking up the load of an object too far away from your body. You've probably heard in the past you're supposed to keep your back straight and lift with your knees. The real reason to do that is because it allows you to keep the heavier load close to your body and in line with your core and your back. So if you imagine you're picking up a box or an object of some kind, the most important thing that you can do to prevent injuring your back is to keep that object as close to your body as possible. If you have to carry something way out in front of you, you're much more likely to injure your back because it creates a stronger lever, pulls on your lower back, and that can often lead to injuries. So those are probably the two most important things that you can do to prevent back injuries. Then what do you do if you have injured your back? If you've lifted something or not even sure what you've done, but you realize you're having a lot of back pain? There are home care options, and there are some things that you should come into the clinic and be seen for. If you have simple low back pain, particularly after a lifting injury, the best thing that you can do is to rest it for a few hours, but probably not longer than that. Consider applying ice to the area where you have discomfort. Ice is nature's anti-inflammatory. People like to put heat on an injury right away, but the reality is that increases blood flow and can increase inflammation. It feels better than putting ice on, but ice is the right thing to do for the first 48 to 72 hours. Get that area cooled down. In addition, taking over-the-counter anti-inflammatories like ibuprofen in the 200 to 400 milligram strength, or naproxen sodium, which is otherwise known as Aleve, but it's the same thing if you take the generic. Those come in 220 milligram tablets, and you can take 1 to 2 of those up to twice a day. A little bit stronger than ibuprofen for most people, and all the more important that you always take it with a meal. So ibuprofen or naproxen, don't combine them, and always taken with a meal can be a really good anti-inflammatory if you have a back injury, along with ice. And then gentle stretching exercises. So bending forward at the waist, rotating at the waist, extending the back. You can look up some back stretching exercises also online for some instructions on what to do. However, if your back pain is really severe, or the pain is radiating down your legs, or you have weakness or numbness in your legs or in the groin area, it's really important that you do get in to be seen to make sure that you don't have a more serious injury, such as a disc herniation, which is where one of the vertebral discs in your back that are normally there to provide cushioning between the bones, those can actually be so compressed during an injury that they can kind of squish out onto one side and press on the nerve. That can be really painful, and in some cases it requires treatment like surgery, but in most cases you can get away with physical therapy, stretching exercises, and anti-inflammatories. So if you have severe pain radiating down the legs, or weakness or numbness, you should get into a clinic. Urgent care is a great place for that, to be seen and evaluated for your back injury. Most of the time you won't need x-rays or an MRI, but a qualified healthcare provider should be able to help you make that decision. Finally, the question is, when is back pain not just a musculoskeletal injury? When is it something more serious? I can tell you that on our end as healthcare providers, the things that we worry about that make us think maybe this is not just a musculoskeletal injury like a sprain or a strain, but maybe it's something more serious like a tumor or an infection of the back. The kinds of questions that we will want to know the answers to are, have you had a fever along with this? Are you somebody who is at increased risk of infections, like someone who has immune compromise that can be diabetes, that can be on immune compromising medications because of organ transplants or other chronic diseases, fevers, weight loss. Again, those symptoms are numbness or weakness in the legs or in the groin area, especially if you haven't had an injury. Those are all really concerning things to us as healthcare providers, and then we will quite likely refer you for something like x-rays or an MRI or specialty evaluation. So keep those in mind. If you haven't had a lifting injury and now you're experiencing severe back pain, weakness, or numbness, or if at any time your back pain is accompanied by fevers or weight loss, we definitely want to see you in the clinic. It can be urgent care, your primary care provider, or the emergency department. And if you just really aren't sure and you're not somebody who's comfortable looking it up on Google and trying to figure out for yourself what stretching exercises to do or what kind of injury that you do have, you can come into any one of our legacy GoHealth urgent care clinics or any one of our GoHealth urgent care clinics across the country, and we would be happy to evaluate you and help you decide what the best next steps are for your back pain. Thanks for listening. I hope that you all stay well, stay healthy, get plenty of exercise. The weather's warming up, so get out there and enjoy it.